Hello, I'm Dr. Jeff Capes, and I'd like to talk to you today about three really important topics that seem to be in discussion almost every day in my practice. One is the vaccine, and many questions come up about that. The other is what's going on with our COVID protocols at this stage, and what about the CDC and the CDC guidelines. On the vaccination side of things, this was something that everyone's been anticipating, including myself. And so the first thing I would tell you is I have received the vaccine. I've had both of the shots, and I was excited that I was able to make that available to my staff as well. Many people ask me, is it safe? Should I do the vaccine? And I would say this, one, these vaccines were studied extensively, month-long testing, over 40,000 people participated in that study. And now we actually have a track record. I think as of last, maybe over 10 million people have received the vaccine. And so I would encourage people to get the vaccine. I do believe it is very safe, and I think it's going to make a huge impact in this pandemic. And it'll be a path for us to try to get back to a normal. When we talk about COVID protocols in our office, when this started almost a year ago, it's hard to believe, but for 2 months we were shut down. And we went immediately into a mode of how are we going to see our patients safely, keeping our patients safe and our practice safe. And so when we did open up and we started seeing patients, we really had implemented a lot of different protocols. One, we eliminated the reception room. Two, we added things like filtration on our HVAC systems. We have fogging devices that we use with hypochloric acid to kill all surfaces. And so these protocols we're actually continuing to do today. The pandemic has not left us. We continue not to have a reception room. We continue to follow the CDC guidelines because at the current moment, continuing to reduce the spread of the COVID virus is paramount. We want to keep you safe. We want to keep our practice open. When it goes to the CDC guidelines, many of those are still in place that we've had for a long time. Now, with the vaccine, we're starting to see some changes in protocols as, quarantine. How long do I have to stay if I'm exposed? But it's interesting how many patients are still a little bit confused about what the recommendations are. And we do have patients who show up at our practice for an appointment, but unfortunately, they've had an exposure during a certain time frame. And I just want to review just real quickly. If you have been exposed to someone who is positive, you still have to quarantine 7 or 10 days. 7 days and then with a negative test, or 10 days with no test. So many of our patients get exposed, they do a negative test 2 or 3 days later. That unfortunately is not the guideline. So I encourage people to go to the CDC site. They're there, the information is available. And all of the guidelines that you'll see, those are the ones that we implement in our practice. This I can promise you, your safety is paramount in our practice. And we're going to continue to do everything in our capabilities to do that for you. But it really goes both ways. We want to keep our practice open. I want to keep my staff safe as well. So if you have further questions, any concerns about what our protocols are, please don't hesitate to call our office. Any of my staff or myself will be happy to help you with that. Take care. We look forward to taking care of you in the future.